What if I told you that there is a company that achieved a stunning 90,778% growth in just 3 years? It wasn't a tech unicorn from Silicon Valley or a trendy new app, but an upstart in the unglamorous world of primary care. In just a few years, Vytalyze Health had skyrocketed with an astonishing growth rate and over $1.5 billion in revenue. How did two college friends manage to reframe American medicine and build one of the country's most successful new businesses? This is the story of Vytalyze Health and how a bold vision to fix primary care is changing the future of healthcare. The problem with primary care. To understand Vytalyze Health's mission, first consider the challenge they set out to solve. Primary care physicians are the front line of healthcare, the doctors we trust for checkups, managing chronic conditions, and guiding our overall health. But in the United States, being a primary care doctor isn't easy. These clinicians often find themselves drowning in responsibilities beyond patient care. They're not just doctors, but also data analysts, accountants, and small business owners struggling to keep their practices afloat. They spend hours battling paperwork, insurance claims, and bureaucracy, often waiting months or even years to be paid for services they've provided. All of this comes on top of long days seeing patients back to back. It's no wonder many doctors feel burnout, and patients often sense that their doctors are rushed or frustrated. Dr. Amir Al-Najjar, a young internist, saw these problems up close. During his medical residency around 2014, he was shocked by how outdated and inefficient things were. Patient charts were still on paper, important information was siloed, and when he asked why healthcare wasn't using better technology, he was told to stick to the clinical work and leave the rest to administrators. To Dr. Al-Najjar, that answer wasn't good enough. Healthcare was 30 years behind other industries, he later observed. He noticed countless broken things in healthcare, from the lack of modern tech tools to perverse incentives that left doctors overworked and patients underserved. He began to insist that providers learn the business of healthcare because without fixing the system around the medicine, even the best doctors would struggle to care for patients properly. Around the same time, Faris Gawi, a friend of Al-Najjar's from college, was building a career in engineering and business. Gawi had a head for data and operations, and he shared Al-Najjar's passion for fixing big problems. The two had been good friends for years, having met as undergraduates. Al-Najjar went on to medical school while Gawi pursued an MBA, but they stayed in touch. They realized that together they had a unique combination of skills. One deeply understood medicine, the other understood business and technology. And most importantly, both were determined to tackle the flaws they saw in the healthcare system. A bold idea is born. In 2014, Faris Gawi and Dr. Amir Al-Najjar decided to join forces and do something revolutionary, reinvent the primary care model from the ground up. They envisioned a new kind of healthcare company, one that would free doctors to do what they do best, take care of patients, by taking away the burdens and inefficiencies that made primary care so dysfunctional. Their first step was small but ambitious. Initially, Vytalyze Health started as a cash-based urgent care app, essentially a service that would allow patients to get primary care on demand, almost like an Uber for doctors. Al-Najjar and Gawi saw it as a side project at first. Patients could request a visit 24/7, and a doctor or nurse practitioner would meet them wherever needed, at home or via video call. The idea was to make access to care easier and more immediate. They charged cash for these visits, avoiding insurance hassles and proving that many routine needs could be handled quickly and conveniently outside the ER. It was an exciting concept and a promising start, but as the duo delved deeper, they found that this urgent care on demand model was only scratching the surface. The more they dove into the healthcare system and its inefficiencies, the more their vision evolved. They didn't want to just create another clinic or app, they wanted to fix the underlying system. They began asking bigger questions. Why are primary care doctors financially penalized for spending time with patients? Why are outcomes worse when care is rushed? What if someone redesigned the incentives from scratch to reward keeping patients healthy? Gawi and Al-Najjar soon realized that tweaking one part of the system wasn't enough. So they pivoted. In fact, they pivoted many times in the early years, experimenting with different care delivery models, revenue models, and technologies. They ran a small primary care practice themselves in New York, focusing on Medicare patients, seniors, to learn what worked and what didn't. They even revived the old-fashioned idea of house calls, visiting elderly patients in their homes on a regular basis. It might sound counterintuitive for a high-growth startup, but those personal house calls taught them something fundamental. When you build trust between doctors and patients, a lot of wonderful things happen, as Dr. Al-Najjar put it. Patients who trust their doctors are more likely to follow medical advice, manage their conditions, and avoid unnecessary hospital visits. This became a pillar of Vytalyze's approach. During those early experiments, the two founders also confronted a sobering truth. Healthcare is complex. Faraz Gawi later explained that in healthcare, technology alone is not enough. You've got to have all the pieces. Unlike some tech entrepreneurs who tried to disrupt healthcare with a slick app while ignoring the messy realities, Gawi and Al-Najjar were determined to tackle every piece of the puzzle: clinical care, insurance payments, technology, patient engagement, all of it. We didn't shy away from things that were hard if we felt they were the right thing to do, Gawi said. Instead of taking the easy route, they embraced the complexity. They believed that to truly change outcomes, they had to build an organization that combined the best of medicine, technology, and finance. This meant pivoting repeatedly, learning from failures, and iterating on their model until they got it right. Cracking the code: value-based care. By around 2017, Vytalyze Health had honed in on a model that showed incredible promise. They aligned their company with a growing movement in American healthcare known as value-based care.
We're going to give you better care, better services. The savings comes as the end result of doing all those things. Keeping people healthy is the goal, not just taking care of them once they're sick.
In simple terms, value-based care means doctors and healthcare providers get paid for keeping you healthy rather than for the number of tests or procedures they perform. It's the opposite of the traditional fee-for-service system, which often unintentionally rewards quantity over quality. The U.S. government had been encouraging doctors to form accountable care organizations, ACOs groups, that take on the care of a population of patients and share in the savings if those patients stay healthier and cost less to the system. For independent primary care doctors, these programs were a double-edged sword. On one hand, they offered a chance to earn more by preventing illness and cutting waste. On the other, they were risky and complicated. A small doctor's office isn't equipped to negotiate with insurers, analyze mountains of data, or wait 2 years to get a bonus check for savings achieved. Dr. Al-Najjar heard horror stories from fellow physicians. They joined value-based programs that promised extra money if they hit certain quality goals, only to receive nothing or even lose money because the system was stacked against small practices. Many gave up, feeling burned by the experience. Gawi and Al-Najjar saw an opportunity here. What if someone could shield the doctors from the downside risk and the bureaucratic headaches, while still letting them reap the benefits of value-based care? Vytalize Health decided to be that someone. We determined from the outset that we were going to be different, Faraz Gawi noted. They transformed Vytalyze into an all-in-one platform for independent primary care practices to succeed in value-based care. Practically, that meant Vytalyze would partner with doctors and take on the heavy lifting, everything from data crunching to care coordination to upfront financing, so that doctors could focus on patients. In 2018, the company took a major step. It paired its successful clinical model with an innovative business model. Vytalyze would contract with Medicare and other insurers on behalf of its network of doctors and take full financial risk for the cost of those patients. In plain language, Vytalyze promised to Medicare, if our patients cost more than expected, we'll cover the losses. But if we save money by keeping them healthier, we get to share in those savings. This was a bold gamble for a young company, but it worked. Crucially, Vytalyze didn't make doctors wait years to see the rewards. Instead of the usual long delay, Vytalyze pays out shared savings quarterly to its doctors. Those more immediate rewards kept physicians motivated and financially stable. As Gawi explained, one major complaint they heard was how long it took to get paid for good outcomes. So Vytalyze simply changed the timeline.
Helped me to put all of that into one bucket where I could keep track of my patients a little bit better. I could see where they are, who they're seeing, what medicines they're taking, and it just became one centralized place for me to do that.
Doctors in the Vytalyze network now get bonus checks every few months when they keep patients healthy and costs down, rather than waiting indefinitely. But Vytalize Health's approach to saving money is not about denying care or cutting corners. Quite the opposite. They figured out that investing in more care up front leads to better outcomes and lower costs overall. Vytalize provides each primary care practice in its network with a whole support system that most small clinics could never afford on their own. As Dr. Alnajar describes it, when clinicians' efforts are supported by a team providing virtual care, in-home care, care coordination, and data analysis, such as we do at Vytalize Health, good clinical outcomes are accompanied by strong financial performance. In other words, if you give doctors more resources and support to look after patients between visits, those patients stay healthier and avoid expensive hospital trips. How Vytalize Health works. So what exactly does Vytalize Health do differently? The company has built a 360-degree support model for primary care. Dedicated care teams. Every practice working with Vytalize gains access to a team of specialists, like virtual care nurses who can check on patients by phone, care coordinators who arrange follow-ups and home visits, and data analysts who identify which patients need extra attention. It's like giving a small doctor's office a supercharged extension of their staff, without the practice having to hire those people themselves. Data-driven insights. Vytalize integrates with the practice's electronic health records and analyzes claims and clinical data to find care gaps. For example, their system might flag that a diabetes patient hasn't had a foot exam this year, or that someone with hypertension hasn't filled a prescription. Vytalize's technology provides actionable recommendations based on evidence-based guidelines, so doctors can proactively address issues before they snowball into emergencies. Virtual and in-home care. Beyond the walls of the clinic, Vytalize helps set up virtual visits and even sends providers for house calls when needed. This is especially important for elderly patients or those with mobility challenges. By meeting patients where they are, whether on a smartphone or at their kitchen table, they ensure patients get care when and where they need it, not just when they can manage to come into the office. End-to-end coordination. Vytalize acts as a connector in the healthcare ecosystem. They integrate each primary care office with high-performing specialists, hospitals, and ancillary services. If a Vytalize patient does need to see a cardiologist or go to the hospital, the primary doctor is looped in and the care team helps coordinate the next steps. This prevents patients from falling through the cracks, a common issue in fragmented healthcare systems. Financial alignment. Perhaps most importantly, Vytalize aligns incentives so that what's good for the patient is also good for the doctor. Doctors remain independent. They don't become employees of Vytalize, but Vytalize handles the insurance contracts, paperwork, and risk. There's no upfront cost or downside for a practice to join. If savings are achieved, Vytalize and the practice share the upside. If not, Vytalize absorbs the loss. This model eliminates the fear that many physicians have about value-based programs. As Dr. Alnajar puts it, Vytalize is really making it very easy for doctors to join value-based care. We take all the downside risk. A doctor can focus on improving patient care without worrying about getting hit with a bill if things don't go perfectly. The cumulative effect of this model has been extraordinary. By freeing doctors to do what they do best, treat patients, and giving them the time and support to do it properly, Vytalize Health has achieved results that hardly seem possible in the traditional system. Patients under Vytalize-affiliated doctors actually see their primary care doctors 78% more often than the average Medicare patient, and those doctors spend triple the usual time with each patient during visits. It might sound like healthcare heresy to have doctors spend more time with patients and see them more frequently. Typically, that's considered inefficient. But this strategy paid off in spades. With more frequent check-ins and a stronger relationship, chronic illnesses are better managed, and new problems are caught earlier. According to Vytalize, their partner clinics have seen a 41% drop in emergency room visits and a 38% drop in hospital admissions among their patients. Think about that. Nearly half of the ER trips that would normally happen were prevented, simply because patients' needs were addressed before they became emergencies. In healthcare, those are staggering improvements. One of Vytalize's physician partners, Dr. Ruben de los Santos, described the impact on his own practice. "It's been a great addition to our system. It helps me monitor patients, what they need, what they have, what to look for. It keeps us on track, making sure we're doing everything we need to do, allowing the patient to have the best quality of care possible. Vytalyze improves our system tenfold. This kind of testimonial illustrates why word began to spread among independent doctors. Vytalyze wasn't asking them to change how they practice medicine. It was giving them the breathing room and support to practice the way they always wished they could. And what about patients? Take the example of an elderly patient with multiple chronic conditions under a Vytalyze affiliated doctor. Instead of only hearing from the doctor's office a couple of times a year, that patient might get regular phone check-ins from a nurse, quick follow-up calls after any specialist visits, and even help coordinating transportation to appointments. If they start to feel symptoms worsening, they can get a video visit on the same day instead of waiting weeks. All of that means small health issues are addressed early, medications stay on track, and the patient feels cared for and heard. So when Vytalyze's data showed a 17% increase in patient retention, it wasn't surprising. Patients are less likely to switch doctors or skip appointments when they're this well supported. Perhaps most importantly, by avoiding unnecessary hospitalizations and procedures, the whole system saves money, roughly 9% cost savings in the Medicare budget for those patients, and Vytalyze shares those savings back with the clinicians. It's a win for the patient, the doctor, and even the taxpayer footing the Medicare bill. Skyrocketing growth. By solving a real pain point in healthcare, Vytalize Health tapped into something powerful. The company's growth tells the story. Founded in 2014 with just 2 founders and a big idea, Vytalyze has since expanded at a pace rarely seen in healthcare. By 2021, Vytalyze was managing over $1 billion in medical spending for more than 600 providers. A year later, it had partnered with 280 practices across 16 states and was responsible for the care of 130,000 senior patients. But that was just the beginning. As the U.S. healthcare system increasingly shifted toward value-based models, Vytalyze's approach gained traction rapidly. By 2023, Vytalize Health's network had grown to over 3,000 healthcare providers across 36 states, caring for more than 250,000 Medicare beneficiaries. That year, the company's explosive expansion earned it the top spot on the Inc. 5000 list of America's fastest-growing companies, with a jaw-dropping 3-year growth rate of about 90,000%. In an industry where new startups often struggle to get a foothold, Vytalyze had effectively created a movement. Thousands of primary care doctors were now on board, and the model was proving itself at scale. This kind of growth doesn't happen without attention from investors, and indeed, investors took notice. Vytalize Health has raised over $200 million in funding to date from venture capital and private equity firms that specialize in healthcare. These investors saw that Vytalyze was onto something revolutionary. As one lead investor said after backing the company, Vytalyze and its network of practices have repeatedly demonstrated they can improve the quality of care for patients while also better managing healthcare spending overall. In other words, Vytalyze showed that doing right by patients could also be great business, the holy grail in healthcare innovation. With new capital in hand, Vytalyze accelerated its expansion. It began partnering not only with doctors in the traditional Medicare Shared Savings Program, but also started working with Medicare Advantage plans and commercial insurers, aiming to bring its model to younger populations and other markets. In early 2022, Vytalyze even made a strategic acquisition. They bought a startup called MedPilot, which specialized in patient communication and engagement. This move was about controlling the last mile of patient engagement, things like appointment reminders, billing communications, and patient education. By incorporating MedPilot's capabilities, Vytalyze ensured that every interaction with patients, even outside the doctor's office, could be streamlined and patient-friendly. It was yet another piece of the puzzle to make healthcare more efficient and effective. Despite its rapid success, the journey wasn't without challenges. Faris Gawi has been candid that hypergrowth came with growing pains. You have to try to match the growth with the infrastructure, and it's impossible to get it exactly right, he noted. Vytalyze's team ballooned. They have hundreds of employees now, and scaling the operations behind the scenes, hiring staff, building software, expanding to new regions was a constant race. We've made all kinds of mistakes across everything you could possibly think of, Gawi admitted with a dose of humility. There were times they overspent in some areas and underspent in others. Times they had to play catch-up to support the growth that was already happening. But those struggles were tempered by a strong company culture. Gawi points out that Vytalyze's team shares a deep belief in the mission of value-based care. The people that have joined Vytalyze are value-based care believers, optimists who have seen how this system works at its best and are here to make it work at its best at scale, he said. That passion for the mission helped Vytalyze maintain its identity, even as it grew 100-fold. They all knew that growing was not the end goal, improving healthcare at scale was. A new vision for healthcare. 10 years ago, Faris Gawi and Amir Al-Najjar were just two college buddies with a crazy idea. Today, they lead a company that is transforming how primary care is delivered to hundreds of thousands of patients. And they're not stopping there. Vytalize Health is already looking to the future of healthcare beyond Medicare. They've begun expanding into Medicaid and commercial insurance, adapting their model to help doctors who serve all types of patients. Dr. Al-Najjar is especially excited about this direction. He often says he's such a fan of value-based care that he wants to see it spread to as many practices as possible in every corner of the country. Their timing couldn't be better. The Centers for Medicare and Medicaid Services, CMS, has set a goal that 100% of traditional Medicare beneficiaries be in a value-based care relationship, like an ACO, by 2030. In other words, the kind of model Vytalyze championed is on track to become the new normal. Now is the time to get out in front of that trend. Faris Gawi urges his fellow healthcare leaders. He encourages doctors to partner with organizations that respect your autonomy, enable you to focus on patient care, provide the support you need, and let you share in the cost savings now, not later. That statement is practically a manifesto for Vytalize Health's value proposition. The story of Vytalize Health is more than just a business success story. It's a glimpse into what the future of healthcare could look like. A future where your primary care doctor isn't a harried gatekeeper, but a true partner who has the time to listen and the backup to act on your needs. A future where keeping people healthy is financially rewarded just as much as treating them when they're sick. In a future where technology and data quietly work in the background, empowering human caregivers rather than replacing them. At its core, Vytalize Health's innovation was to realign the system with its humanity. Faris Gawi likes to say their ultimate goal is to strengthen the special relationship between patients and their primary care doctors. It's a simple idea with profound implications. By rebuilding healthcare around that relationship, Vytalize has shown it's possible to have better outcomes and lower costs at the same time. For Gawi and Al-Najjar, the journey from scrappy startup to industry magnate has been intense, but their focus remains on the mission, not the accolades. I don't care about titles or roles. I care about making a change, Dr. Al-Najjar said. At Vytalize Health, I am a conduit to help improve patients' lives and help physicians have better businesses. In other words, success to them isn't measured just in revenue or growth metrics, but in lives improved. Patients who get to stay healthier and doctors who get to practice medicine the way they always hoped they could. As we close the story of Vytalize Health, for now, consider the ripple effect a company like this can have. Hundreds of independent clinics remain independent and thrive because of Vytalize's support. Thousands of patients are avoiding unnecessary hospital trips and feeling more connected to their doctors. And the broader healthcare system is learning that change is not only possible, it can happen fast when the incentives line up right. From two friends with an idea to a nationwide network changing healthcare for the better. Vytalize Health shows what's possible when innovation and compassion work hand in hand. And this may just be the beginning. In the years to come, you might find that your own family physician has partnered with a company like Vytalize to provide a higher level of care. If so, you'll likely notice the difference. More time with your doctor, more follow-up between visits, and a healthcare experience that actually feels caring and proactive. That's the vision Faris Gawi and Amir Al-Najjar set out to achieve. By empowering doctors and valuing patients, they have created something truly vital, living up to the name Vytalize Health. And in doing so, they just might be revitalizing the very heart of healthcare.